It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I answered a question from one of our readers of our blog, and the question last week was, my 73-year-old mum had a stroke and is intubated in intensive care. She can't come off the ventilator and the breathing tube. Can she have a tracheostomy and go home and have intensive care at home? You can check out last week's episode by clicking on the link below this video. In this week's blog, I want to answer another question that we get quite frequently from our readers and also from clients who want to or take up our service intensive care at home. And the question this week is tracheostomy and weaning off the ventilator in intensive care. How long can it take? It's a great question to ask, especially for anyone who has a loved one in intensive care on a ventilator with tracheostomy, whether it be an adult, a child, or even a toddler. Especially if you and your family have been putting your life on hold because your loved one stays in ICU, pediatric ICU, or neonatal ICU for many weeks or many months on end, you and your family need to ask this question rather sooner than later. And you need to look for genuine alternatives to a long-term stay in intensive care. And we can offer you this genuine alternative to a long-term stay in intensive care with our service, Intensive Care at Home. So if your loved one in intensive care has been in an induced coma and now has a tracheostomy, there are several reasons why your critically ill loved one required a tracheostomy in the first place. Most of the reasons for a tracheostomy you'll find are outlined in another blog post that we wrote about how long should a patient be on a ventilator before having a tracheostomy. This blog post today, however, gives you answers to how long it should take your loved one to be weaned off the ventilator and the tracheostomy, and it looks at genuine alternatives to a long-term stay in intensive care, like intensive care at home. A tracheostomy is generally speaking a straightforward procedure in intensive care, and after the tracheostomy has been inserted, generally speaking and in many cases, the weaning process for your critically ill loved one to come off the ventilator can be started immediately. That being said, keep in mind, your critically ill loved one has been placed in an induced coma so that they were able to tolerate the breathing tube. A tracheostomy tube is so much easier to tolerate for your loved one so that they don't need any sedation, which are drugs that make your loved one sleepy. Therefore, once a tracheostomy has been done, sedation can be weaned, reduced, or even completely switched off, and the number of drugs given are minimized, which is a good thing. With the sedation minimized, your loved one should come out of the induced coma and should then be ready to take the first steps to be weaned off the ventilator. Those first steps are usually to reduce support from the ventilator and then let your loved one do more of the work required to breathe, while still getting support from the ventilator. And then the next step is to take your loved one off the ventilator completely for a few hours and just support them with an oxygen mask, also known as a trachea mask, trachea shield, or trachea hood, just above the tracheostomy. This usually gives you, your loved one, and the ICU team or a home care team a good indication of how long the process might take to wean your loved one off the ventilator. The frequency that your loved one stays off the ventilator should increase day by day, with the goal to be off the ventilator within a few days or a few weeks at the most. This is if all goes well and planned. Sometimes your loved one may stay off the ventilator during the day and go back on the ventilator again during the night until they can be without the ventilator for 24 hours. After your loved one has been without the ventilator for a few days, they should be able to have the tracheostomy removed as well. If your loved one has a good strong cough and after a swallowing assessment has been done by a speech therapist. Depending on the underlying admission scenario and other medical issues that your critically ill loved one is dealing with, the process of weaning your loved one off the ventilator might not be a straightforward process, and numerous setbacks might occur and therefore delay and prolong the weaning process of the ventilator. The most common issues that might delay and prolong the weaning process are respiratory conditions such as pneumonia, COPD, asthma, pleural effusion, and also lung transplant. Also, excess sputum production that requires regular and frequent suctioning via the tracheostomy. Also, neurological conditions such as stroke, brain or head injuries. Obesity, confusion and aggression. Depression in intensive care or also in long-term acute care. Another big factor is lack of quality of life in intensive care, because there is none. But there is quality of life at home. Also, lack of privacy and dignity in intensive care or long-term acute care. Feeling helpless and not in control of the situation. Your loved one also most likely has a disturbed day and night rhythm, or lack of sleep or sleep deprivation and lack of natural daylight in intensive care. And sometimes there can also be a psychological dependency on ventilation support, especially after many setbacks and failed trials to come off the ventilator. So these are the most common scenarios where a weaning of the ventilator with a tracheostomy can be delayed and therefore difficult, and the weaning process in intensive care can therefore then take many weeks and many months before a discharge out of intensive care is possible. And if you're watching this and you are in the United States, the same applies to long-term acute care. It's not the right place to wean somebody off the ventilator. The stories we hear from long-term acute care are atrocious. So a home care environment is so much better. So next, after the clinical issues are taken care of in intensive care, you may find that your loved one gets depressed in intensive care or long-term acute care because of lack of quality of life, the feeling of helplessness, the lack of privacy and dignity, the sleep deprivation, and because of the disturbed day and night rhythm. And this can turn into a vicious cycle with a ventilator dependency triggering the depression and the depression triggering the ventilator dependency. This is especially true the longer your critically ill loved one stays in intensive care. Increased length of stay in intensive care, depression and lack of quality of life usually go hand in hand. This means that your critically ill loved one might get psychologically dependent on the ventilator because of the reasons that I just mentioned, and they delay the process of your loved one being able to breathe without the ventilator. There are a rising number of patients in intensive care, including pediatrics and neonatal intensive care, that are long-term ventilator dependent with tracheostomy, and they are therefore trapped in intensive care with no quality of life and often with no perceived alternative but to stay in intensive care for long periods of time without ever leaving intensive care. Those patients and their families in intensive care feel like they have no control over the situation, and they therefore feel like they are at the mercy of the intensive care doctors and nurses. So the good news is that intensive care at home nursing is a solution to the dilemma. After a few weeks or after a few months in intensive care because of the ventilator dependency, there is a relatively high chance that your critically ill loved one is getting weaker and weaker and is losing the will to live. The inhibiting and limiting intensive care environment, also long-term acute care environment, where quality of life or quality of end of life cannot be achieved, are more often than not a downward spiral for your critically ill loved one in many intensive care units and long-term units as well may actually tell you that because of the inability for your loved one to move forward, that they may have to withdraw treatment or limit treatment and let your loved one die. This would be very sad, and it certainly doesn't have to be that way, because there are ways forward, mainly intensive care at home. Intensive care at home improves patients and their families' quality of life, and in some instances quality of end of life. We have provided palliative care in the home as well. We are all about creating win-win situations, and that includes helping intensive care units freeing up their in-demand, expensive and therefore precious intensive care beds. We are able to reduce the cost of a $5,000 to $6,000 per bed day intensive care bed significantly to about 50% of the cost, and patients and families are in a much more patient and family-friendly home care environment. Usually in an intensive home care environment like intensive care at home, quality of life can be restored very quickly, and patients and their families have real control over their lives, and they are far less dependent on a regimented, institutionalized, sterile and clinical environment. Some ventilator-dependent adults and children are able to go back to work or go back to school, university or kindergarten with the support structure of intensive care at home services. Intensive care at home services provide up to 24-hour care 7 days a week, 365 days a year, and we provide similar services compared to intensive care, where weaning off the ventilator is possible as well in a much more patient and family-friendly environment. So if you want to find out how we can help you to get your loved one out of intensive care, including palliative care, also out of long-term acute care or a nursing home, or if you find that you have insufficient support for your loved one at home on a ventilator, please contact us on one of the numbers on the top of the website, or just email me to patrick@intensivecareathome.com. That's Patrick just with a K at the end. Also, check out our career section. We are currently hiring ICU and pediatric ICU nurses for clients in Melbourne, Sunbury and in South Gippsland in Victoria. We are also an NDIS, TAC and DVA approved community service provider in Australia. We have also been part of the Royal Melbourne Health Accelerator program earlier this year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.